Deep cervical fascia. There are three layers of deep cervical fascia: investing fascia, pretracheal fascia, prevertebral fascia. All are circular fascia. Investing fascia. It is the most superficial layer. It goes around the neck circumferentially. It splits and encloses the sternocleidomastoid under the trapezius muscle. It also becomes the roof of posterior triangle of neck. Prevertebral fascia. It forms the floor of posterior triangle. It is bounded by sternocleidomastoid muscle anteriorly, trapezius muscle posteriorly. It is present in front and around the vertebra. It encloses the paravertebral muscles posteriorly. Pretracheal fascia. It covers the strap muscles of anterior neck region. It lies in front of trachea and also goes behind it in circular fashion. It also covers the pharynx and esophagus behind the trachea. Carotid sheath. It is contributed by all three layers of fascia: laterally by investing fascia, anteriorly by pretracheal fascia, posteriorly by prevertebral fascia. Main contents of carotid sheath: internal carotid artery medially, internal jugular vein laterally, vagus nerve between internal carotid artery and internal jugular vein. Sagittal view of deep cervical fascia. The pretracheal fascia covers the larynx and trachea anteriorly and pharynx and esophagus posteriorly. Posteriorly, the pretracheal fascia modifies into buccopharyngeal fascia behind the pharynx and esophagus. Neck spaces. Prevertebral fascia. It is a space in front of vertebra. It is bounded by prevertebral fascia anteriorly and vertebra posteriorly. Prevertebral fascia has two layers: prevertebral fascia proper, alar fascia anteriorly. Dangerous space. It lies between prevertebral fascia proper and alar fascia. It is also called as danger space because any infection or pus in this space can pass from neck region into mediastinum of thorax region. It is also called as third space, posterior compartment of retropharyngeal space. Retropharyngeal space. It is also known as retroesophageal space. It lies behind the pharynx or esophagus. It is bounded by buccopharyngeal fascia anteriorly and alar fascia anteriorly. Important information. Buccopharyngeal fascia is the modification of pretracheal fascia. Superior view of transverse section of neck. Here we can see that pretracheal fascia has two layers: pretracheal fascia muscular layer to cover the anterior neck muscle, pretracheal fascia visceral layer to cover viscera. The visceral layer of pretracheal fascia covers the trachea, esophagus, and thyroid gland. Behind the pharynx and esophagus, the pretracheal fascia modifies into buccopharyngeal fascia. The space behind the buccopharyngeal space is called retropharyngeal space. The carotid sheath is contributed by all three layers of deep cervical fascia. Recap: superficial fascia, central compartment, visceral space of compartment, pretracheal space, esophageal compartment, carotid space, carotid sheath, retropharyngeal space lies posterior to pharynx and cervical esophagus. Retrovisceral or retroesophageal space, dangerous space, lies between alar fascia and prevertebral fascia. Third space, posterior compartment of retropharyngeal space, buccopharyngeal fascia, alar fascia, prevertebral fascia. Prevertebral fascia lies between prevertebral fascia and vertebral column. Perivertebral space, paraspinal space, prevertebral space, space in front of vertebra but behind the prevertebral fascia proper. Dangerous space, space in front of prevertebral fascia proper but behind alar fascia. Retropharyngeal space, space in front of alar fascia but behind buccopharyngeal fascia. Carotid sheath contents: common carotid artery, lateral internal carotid artery, internal jugular vein, vagus nerve. Ansa cervicalis is embedded anteriorly on carotid sheath. Sympathetic chain with stellate ganglia lies posterior to the carotid sheath. Brachial plexus lies between scalenus anterior muscle and scalenus medius muscle. Brachial plexus can be blocked in interscalene muscles. Carotid sheath contents: common carotid artery, internal jugular vein, vagus nerve. Common carotid artery, internal jugular vein, vagus nerve.